So treatment or intervention of autism spectrum disorder in adults and Asperger's syndrome in adults is I would argue, and I'm a medic, I'm a psychiatrist, is primarily after diagnosis is about social care, including education, of course. It sometimes does require health input for behavioural management and sometimes even the cautious use of medication. So we do need those medical skills in place to make sure those things are managed well. The lower functioning adults on the spectrum have, I would argue, two chances of accessing care by being recognised through their learning disability, and secondly, quite possibly being recognised on the spectrum, particularly if they have challenging behaviour. But adults who are higher functioning don't have either of those opportunities. They are a truly invisible group. And it seems from the report now that very few parts of England have effective systems in place for identifying and supporting higher functioning adults on the spectrum. And I think that the way forward, just to add to the points I've made, is going to be very much about that hackneyed word, partnership, but I think this is one area where it really is crucial. Partnership between health and social care. And it's about bringing the tertiary level, which is the very specialised, the secondary level, which is actually involving mainstream adult mental health services and social care teams, and deep primary care. But the other key partner, and I'm glad it's been said a few times today, is the parent and the parents, if they're still able and still involved and still in contact. And as we see older adults on the spectrum, that is no longer, of course, the case. They continue to be a mine of expertise, and everybody I've trained to do an assessment in adults learns very quickly that the first person you spend a lot of time talking to is the parent, and then the individual themselves. Parents have a wealth of information and are able to give a very good broad picture of things. We need to develop, and to be able to develop sustained and sustainable clear care pathways. And, you know, clearly, and I think David Cameron put this very well, we have a wide spectrum of need, so assessment is going to be crucial, and from time to time reassessment, because you can't really predict how well or how poorly people are going to do. And finally, I think that when it comes to commissioning at a more local level, we're not yet on a level playing field. Asperger's syndrome and autism is not getting a fair shot at things as far as I'm concerned. And I really do hope that the Department of Health will examine this, and I look forward to hearing what, if anything, the Minister might have to say about that shortly. Thank you very much.